Unlike some other viruses, as best we know yet, there is no vertical transmission of COVID-19 from mother to fetus during the pregnancy or from mother to infant at the time of birth. Thus far, it doesn't seem like the infection is worse in pregnant women compared to other individuals. There are some viruses that are worse during pregnancy than in the non-pregnant state. Influenza is an excellent example. The reasons for that have more to do with pregnancy physiology than with the characteristics of the virus. So to be conservative, for now, we are considering pregnant women potentially at risk, not at greater risk of getting the virus, but potentially at greater risk of becoming more severely ill with the virus. We don't know that for sure. It's just something that we're trying to keep in the back of our minds when evaluating if a patient would need to go to the hospital or not, and caring for a coming pregnant patient when that occurs. You've heard about screening, both at entry into the hospitals. We also are screening patients and visitors in our 3 prenatal clinics on campus. We're limiting visitors to the hospital. We're also limiting visitors to our clinics. The approach to testing probably will change, but as Dr. Drevitz said, for now, only patients that are symptomatic are getting tested. That applies also to the pregnant population. And then obviously this is a situation that I anticipate will evolve both for the overall healthcare population and for pregnancy care specifically, and we will continue to work on the situation and evolve care as necessary. Thank you.
I do have the opportunity to give a little bit of good news for the parents and families in Oklahoma, and that is that in general, children have very much milder disease than adults, and most present with minimal or no symptoms. Hospitals in China, Italy, and other states in the United States have reported very few children requiring hospitalization. And so we have every reason to believe that this will also be true in Oklahoma as well. Moderate or severe disease is rare, but slightly more common in infants, especially those under a year of age. And it also may be that children with significant pre-existing medical conditions, such as congenital heart disease, lung diseases such as asthma or cystic fibrosis, chronic kidney or liver disease, those with suppressed immune systems, such as those on cancer chemotherapy, metabolic disorders, or diabetes may be at increased risk. These children in particular should be watched closely for the development of the key symptoms of fever, cough, and particularly difficulty breathing. If this happens, parents should contact the child's healthcare provider. The other greatest concern is that although most children have minimal or no symptoms, they still are infected and can therefore spread the infection to others. There's growing evidence that spread from minimally symptomatic people, including children, exceeds that from those who are visibly ill. Therefore, it's important that efforts be made by parents to take certain actions to help reduce the chance that vulnerable people become infected from exposure to children. As you've already heard, practice social distancing. Limit direct contact with those who are at risk, such as including adults over 60, adults and children with chronic conditions such as heart disease, high blood pressure, diabetes, lung disease, and suppressed immune systems. The best bet is to stay home and practice enhanced hygiene measures. Finally, by now, everyone appreciates that during times of widespread infection, one of the most precious resources that a community must protect is its healthcare providers, who must remain available to treat the most ill. In order to prevent healthcare workers from becoming ill, many centers, including our own, are developing plans to reduce their exposure to potentially infected but not seriously ill patients who can delay care. As a consequence, in the long-term best interest of Oklahoma's families, we are evaluating how we can limit non-urgent visits to our facilities, and we're working to convert as many necessary visits as possible to be available by video telemedicine rather than in person. For patients followed here at Children's, our clinics will be in touch to best determine how to provide your children the care they need while minimizing your family's exposure to COVID-19. Thank you.